Today's topic is 7 things you should and shouldn't do after surgery. A surgical procedure's effect on you does not just end at the operation theater. You need to take special care after the fact to make sure your body heals properly and no complications develop. People often do not take the necessary precautions during aftercare for minor surgeries, considering it to be not that serious. However, any procedure involving incisions and anesthesia needs to be given time to heal properly. With that in mind, here are 7 things you should and shouldn't do after surgery. Don't start driving right after the surgery. The no driving rule after surgery should be followed without question. It is usually advised because of anesthesia administered during the surgery. Anesthesia slows down your motor skills for quite some time, making it difficult to coordinate and take quick decisions. However, more than that, you need to avoid driving to help heal your wound. Moving around the car and exerting your muscles is going to add pressure to the wound and will slow down recovery. Do take pain medication as advised. People usually don't like taking pain medication as it makes them groggy and slows them down. Nevertheless, you should take pain medication if your doctor has advised it. Being in pain will limit your mobility, which increases the risk of blood clots in the legs. To avoid that, you have to be on your feet and active during your recovery. Taking pain medication and not going beyond the prescribed limits is a great way to help you with that. Do not lift things until you are allowed to. Lifting heavy objects is usually discouraged during recovery. Even if you feel strong enough to lift objects heavier than the limit you have been asked to stay under, do not attempt it. You can get worse quite quickly after the exertion, and your healing wound might even open up again. Take it easy and follow the guidelines until you are allowed to lift heavy objects. Do be wary of infection. Incisions during surgery put you at risk of infection during your recovery. To avoid that, you need to keep the wound dry and keep a lookout for possible signs of infection. Tingling, soreness, itching, and a bit of discharge from the wound are all signs of healthy recovery. However, pus, fever, and excessive bleeding are signs of developing an infection, and you have to get them checked out. Don't get constipated. Gastrointestinal surgery puts you at risk of constipation, which is something you cannot take lightly. The strain caused by constipation also acts on your wound and can impede recovery. Do take your antibiotics. Antibiotics prescribed during recovery help protect you against infection. Just because you seem to be doing well doesn't mean you are free of risk. Take the antibiotics as long as you are supposed to. Don't smoke. Smoking makes your wound heal slower, as it causes inefficient oxygen transport in the body. Avoid smoking during recovery at all costs. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.